While we still face very challenging trends in the virus's spread in many parts of the country, thanks to the Operation Warp Speed rollout of vaccines, as General Perna has been saying, we're now on offense against the virus. The vaccines we are distributing are going to save lives. This week, we have allocated more doses of the Pfizer vaccine, approximately 2 million more doses, for states and other jurisdictions to order. On top of that, we've allocated 5.9 million doses of the Moderna vaccine. I look forward to receiving this vaccine myself in the coming days as part of our efforts to demonstrate to Americans that these vaccines are safe and incredibly effective at preventing COVID-19. This first wave of Moderna shipments will be sent to more than 3,500 sites, a greater number than the Pfizer vaccine was sent to, in part because the Moderna vaccine can be accommodated in more sites, including harder to reach and more rural places. As we move forward, states will continue to adjust where they want these doses shipped to meet their needs. As many of you know, this past weekend, the Advisory Committee on Immunization Practices, sponsored by the CDC, made more recommendations about future waves of vaccine allocation. Those recommendations are there for states and other public health jurisdictions to use. We believe that these jurisdictions and their leaders are in the best position to understand their specific needs and allocate vaccines in these early days to save the most lives possible. As General Perna has said, that's the only goal here: save lives. I also want to remind everyone that OWS is not just about vaccines, but also therapeutics. And more Americans need to know about the 2 authorized antibody therapies that OWS supported in development and manufacturing. These 2 products help prevent hospitalizations in those patients with the highest risk for severe disease. We have allocated over 400,000 treatment courses to all states and territories, with 250,000 plus courses delivered, and many states have told us that they still have a lot of product available. If you have tested positive for COVID-19 and are at risk for severe disease based on your age, weight, or underlying health conditions, there may be a therapeutic option that could help you stay out of the hospital. Americans who may fall into these categories can find out more by speaking with their healthcare provider. Finally, I will reiterate what all of our public health leaders have been saying around the importance of mitigation measures as we go through the vaccine rollout. In the coming months, we have to keep up the good public health steps that we've been recommending for months, like washing our hands, watching our distance, and wearing face coverings when we can't watch our distance. This is especially important as we go through the holiday season. The vast majority of us remain vulnerable to the virus, and we need to keep ourselves and our loved ones safe this holiday season. Thanks to the success of Operation Warp Speed, we've got such a bright future ahead of us. Let's all get there safely.